Hi everyone, welcome to Bio 201. This is again the lecture series, and we're going to be talking about joints and movement this time. Okay, so welcome. Let's get started. Let's talk about joint and movement. The first thing you need to know, there are two types of classifications of joints. One is classified by their movement, and the other one classified by their ways of bone joining together. Okay, so movement and joining together. We're going to go over all of these. Okay, please note that movement has three types, and the acronym should be is SAD, SAD. If you want to remember type of movement, SAD movement. So you have the synarthrosis, amphiarthrosis, and diarthrosis. Those are the SAD movement. Okay, and the way the bone are joining, you actually have fibrous type, cartilaginous type, bony type, and synovial type joints. Okay, so we'll go over those specifically. So the SAD movement, based on classification movement, um, sin arthrosis, thinking sin, meaning that you no movement at all. Okay, little or no movement whatsoever. These are the example. You should know the example as well. No movement, like your suture, your sternal ankle, those no movement whatsoever. Amphi means moves a little, okay, slightly movable, move a little bit, and those are like your intervertebral disc, your pubic symphysis, and die move all the time, freely movable. Your elbow, your shoulder, your ankle, all of those are diarthrosis. So you should know these three types, and then should know the example of them as well for your test. Okay. Joint classification, so how they one connects to another, you could check that out. um, let's see, you have the, again, this is how they join together. You have the fibrous type, cartilaginous type, bony type, and synovial joint. Okay, those are the four types. We're going to talk about these three types first, and then we'll get to the synovial joint. So the fibrous type, you should know fibrous type for your test. There are suture, kyphosis, and syndesmosis. Okay, so under fibrous, you have these three types. Okay, um, SGS. Okay, suture, kyphosis, and syndesmosis. You need to know the differences between the three. The sutures has three breakdown to three subtypes. You have the serratus type, okay, like interlocking, meaning that it kind of like, think of your like fingers coming in two together. That's the interlocking. That's the serratus type. Then you have the coronal, sagittal, and lumboid suture. That's three out of the four of your skull suture: coronal, sagittal, and lambdoid. Lambdoid. Okay, squamous suture, that's the only type that's does not look the same. It's basically one on top of another. And then plain suture is no overlapping, just kind of two comes together. Okay, so squamous, just one on top of another, and plain just. So number one, what would that be? And this would be interlocking, right? This is one on top of another, and this one just comes together. Okay, so you could see three different types. Okay, second part of the fibrous joint, okay, is kyphosis. Kyphosis is only happen in your teeth. Okay, kyphosis, think of teeth, tooth socket. Okay, you have these periodontal ligaments. You have these ligaments kind of joining your bone, kind of holding down your bone. Okay, your permanent tooth. Okay, your permanent tooth. That's the periodontal ligament. Okay, so kind of make your tooth kind of move just a little bit while you chew, help with chewing. Okay, help with chewing. And the last fibrous type joint, you definitely need to know this one. You will see this on your test. This is called syndesmosis. Syndesmosis. Okay, so the kind of two bone kind of bounds together with the fibrous ligament. Okay, this is called the interosseous membrane. Interosseous membrane. So you have these ligaments in the middle. This is between your radius and ulna. Okay, your radius and ulna. You have these interosseous membrane that help binds the two together. You might want to know that for your test. Okay. So the second type of classification is called the cartilaginous joint. Cartilaginous joint. And the first subtype of cartilaginous, you have synchondrosis. Okay, synchondrosis. Okay, and under synchondrosis is basically how the bone comes together, and this is where you are using hyaline cartilage. Okay, hyaline cartilage to connect your bone. So basically, this is where your ribs, okay, and also at your epiphyseal plate right here. Okay, that's where the bone comes together, and that's where the hyaline cartilage. That's synchondrosis. Next one is called the symphysis. Symphysis, still under cartilaginous joint. Okay, this one you have the fibrocartilage, so like your pubic symphysis and your intervertebral disc, they are the same, using the fibrocartilage joint. Okay, and the third classification is called the bony joint, called synostrosis. Okay, bony joints. These are the two bones comes together and then fuse, completely fuse. Okay, so it was two bone when you were born, and then it actually joined into one bone later on. Okay, so this is called the bony joint, which is synostrosis. Okay, the example of that would be your coccyx here, and then your mandible as well. So your mandible, you having a separate mandible when you were born, and then that kind of went away. Okay. The fourth type of classification of how they join is called the synovial joint. Synovial joint is basically you have two bone comes together, and then you create these cavities in the middle of your bone. This is where any joint that are freely movable joint, like your fingers, all of your fingers, these are synovial joint. Your knees, your shoulder, your major joints are synovial joint. Even your TMJ is also um, synovial joint as well. Okay. In the synovial joint, you need to know there are specific stuff that actually going on in your synovial joint. One is called the articular joint capsule. Okay, you have these articular joint capsule. You have the synovial fluid. Okay, the liquid that actually in your joint, even between your pharynx. These right here, the proximal pharynx do have liquid inside of them. Okay, they do have liquid inside of them. Articular cartilage, you have these, the white right here. This is the articular cartilage, okay, which is the hyaline cartilage cover it. You also have the meniscus. Meniscus is, think of like a shocks absorption right here. You have the lateral meniscus and you have the medial meniscus. Especially this is for the knee. As we get older, these meniscus actually kind of worn down as well. Like in case of like many professional basketball or athletes, they can actually worn down their meniscus. You should know the term tendon versus ligament. That's going to be on your test as well. Tendons is muscle to bone. Ligament is bone to bone. Just think of like dogs licking bones, right? Ligament, that's how I remember it. Lick is bone to bone. Tendon is muscle to bone. Okay. Birdsey is another one. You actually have a sac-like capsule that actually around your joint, kind of providing support and protection to your joints as well. You also have tendon sheets that actually elongated cylinder tissue that actually help wrap around the joints. Okay, so your synovial joint has a lot of things going to kind of protect the joint itself. You have the ligament, you have these capsule, you have the cartilages, meniscus, bursae that actually around it as well. So a lot of things to kind of protect your joint from damage. Okay. So the next, it's a types of synovial joint. There's different types of synovial joints. First one is called the plane, meaning that it actually only going in one plane. Okay, one plane of movement. It doesn't go up or down. It actually stay in one plane. If you could go forward, go backward, left or right. So it's one plane. You should know the example of these. Okay, so know these and know the example of them as well, like intercarpal intertarsal joint. That's between your carpals bone, so intercarpals, which means your wrist bone is here, between your wrist bone and in between your ankle bone. Okay, uh, and the joint between the vertebral articular process. Okay, vertebral articular process. That's your between your vertebrae. Okay, vertebrae. You have the hinge joint. Hinge, just like think of doors. Hinge is only also uniaxial, meaning only one way, just moving one way, right? The first one is non-axial, meaning that you can fly it off, you can flip on, you just kind of staying on that same plane. So it's staying on that one plane, so it's non-axial. Um, Hinge, meaning that again is like a door, right? The door, like your elbow is a hinge joint because you only have one movement with your elbow. You cannot, technically, you cannot really twist your elbow to the other side. Okay, uh, interpharyngeal joint. Inter means between your pharynx, so interpharyngeal joint is your finger. Okay, you only have one movement of your finger. Okay, that's interpharyngeal joint. Okay, your hinge joint. You also have the pivot joint. Pivot, think of it like a basketball player. You have one foot down, the other foot could pivot around. It's also uniaxial, meaning that only one axis. So it's just going around. It doesn't lift up and twist and turn around. So you have the proximal radial ulnar joint. Proximal meaning that close to your body. So the radial ulnar is right here, right? Your radial ulnar is here. So this is where you do pronation. Okay, we're going to talk about pronate and supinate shortly. This is where you're rotating your arm like this. Okay, so ulnar and the radius. Okay, Atlanto uh, atlantoaxial joint. That's your neck. Your C1 and C2. Okay, that means you help turn your neck left and right. Okay, that's atlantoaxial joint. Next one is called the condylar joint. Okay, condylar joint. This is help with the flexion extension. A flexion should not have a T. Flexion and extension, abduction and adduction. Okay, this is where this is biaxial, so now it's actually two axes, X and Y. So metacarpal pharyngeal joint. So this is your knuckles. Okay, metacarpal pharyngeal joint are these. Okay. Saddle joint, okay, only one location of your foot saddle joint is your thumb, your carpal metacarpal joint. Carpal is your wrist bone here. Your metacarpal is here. Metacarpal is here. Okay, so carpal is your wrist, and metacarpal is this guy here. Okay, so it's a joint that's right here, specifically right here. Um, make it a little bigger so you could see. So right would be right here. Okay, this would be your carpal metacarpal joint for your thumb. Okay, you could actually crack this as well. Okay, you could crack this by pressing on here. Okay, pull it back and crack. Okay, so pull your thumb back and then put your thumb down here, and you could actually crack it. Okay, so that's the saddle joint. Only one in your body is biaxial. What does it do? It kind of help move your thumb in and out like this. Okay, and flexion and extension. So you can move it all the way down like that, and then you could extend it back. Okay, so you actually have two axes. You're biaxial. Ball and socket. That's the most joint in your body, like your shoulder, your hip, your uh, pectoral girdle, pelvic girdle, all of those. So you actually have a multi-axial joint. You actually have a ball and you have a socket inside that actually help keeps move around. Okay, so that's the ball and socket joint. These are the picture, and also you could check out the songs with that. Okay, make sure you check out a picture that I pass it out to you. That's going to be on your test. Okay, so make sure you check out those picture. Uh, we talked about the osteoarthritis before. This is when you're actually getting older. You have inflammation on your joints. You have painful swelling. You should know that for your test. Definitely. Okay. Know this for your test. You will see on your test. This is all of these are cool surgeries of hip and knee replacement. You guys could check it out. really cool. Another one that you definitely going to see on your test is gout. Okay, this is where you actually have a buildup of something called uric acid. Okay, uric acid, where you actually have uric acid crystal. Okay, um, let me show you on the picture on the bottom. You could see the uric acid crystal that kind of form up right here. Okay, um, form up in your between your joint. Okay, um, it's where it's inflamed because your antibody, your body actually immune system start to respond thinking that it's actually a foreign object, so it start attacking it. So that's why it kind of inflame up, and it's very painful as well. Another problem that people who have gout that have to watch out is they could actually have a crystal kidney stone as well. Okay, because uric acid can actually form stone inside your kidney. Okay. Another disease you should know is called the rheumatoid arthritis. This is an autoimmune disease, usually happen with women. It actually affects more than just the joints, but it actually can affect your eyes, your lungs, and your heart as well. Um, this is an autoimmune disease, meaning that it tends to come on later on in life, and also meaning that it's mean autoimmune meaning that your immune system start attacking your own body caused by inflammations. Okay, so you're going to see the hand swollen, you're going to see painful joints. Sometimes this actually can happen earlier because it's genetic condition that can be passed on. Some people can have it since they're younger as well, but most people usually have it in their middle age. Okay. Another one to know is called bursitis. Bursitis, this is inflammation of your bursa in a joint. This is kind of overuse of the joint, like people who actually are athlete using a lot of the joints, like golfer and baseball players, tennis player, usually get bursitis quite a bit. Okay. Last one is called carpal tunnel syndrome. Okay, carpal tunnel syndrome. This is when you overuse your hand. Okay, when you overuse your hand, you actually compress your median nerve right in the middle here. Um, to test it, it's called a Fallon test, which is this: if you push your hands together, you're gonna have pain. Just the first three finger, not the last two. Last two doesn't have actually this median nerve goes to. So if you have pain on the last two, that means you actually are faking it. It's not carpal tunnel. Okay, carpal tunnel is only on the three fingers. Okay, your thumb, index finger, and middle finger. Those are the three fingers. Okay. Um, and the other way you test it, you call Tunnel sign. You could actually just tap on the wrist like this. If you tap on a wrist, you actually, if you have pain, that means you actually have carpal tunnel syndrome. Okay. The last part, and all of this, you're going to see this huge part on your exam. This is something really you should know. You should know the name of these, the movements, and then understanding the description as well of the movement. What happened in the description and the key term in description. Okay. Um, so first one is flexion. Flexion is basically a decrease in the angle of joint, meaning that like when you actually flexing, you actually decrease the angle. Like if you are doing, you standing by with the anatomical position, and then you start flexing your arm, your elbow. Okay, you're decreasing that elbow angle. That's called flexion. Extension is basically increasing that angle of joint. Okay. Um, Hyperextension, that means you extend over the normal amount. For example, you could hyperextend your knee. So your no, not your knee, your neck. Sorry, your neck. So your neck, when you bend down like this, this is flexion. As you're going up, this is called extension. But if you're going way back, that's called hyperextension. Okay, hyperextension. And same thing with your arm. Your arm, harder for me to show, but your arm, if you actually standing up, you could actually have your arm flex. Let me show you. Okay, flexion would be moving forward like this is called flexion, or let's see on the side. Okay, flexion, right? Coming back is extension. But if you're going toward your back, if you're putting your arm harder to see without my body. Okay, if you're putting your arm behind your back like this, that's called hyperextension. Okay, so flexion is moving to the front, extension moving back to the midline, and then a hyperextension moving to the back. Okay, you're gonna see that here. Okay, as I mentioned, the flexion is going forward, extension is coming back to that midline here. Okay, putting your arm back in the middle, and hyperextension is going back here. Same thing here, flexion going forward is flexing, extension going back to the midline, going over the midline. That's called the hyperextension. Same thing with your back. Okay. Again, this is flexing your arm here, hyperextend your arm, flexion of your elbow. Okay, extension. Again, flexion is decreasing the angle. Extension is increasing that angle. Okay. You cannot hyperextend your elbow because you have the olecranon fossa that actually will prevent you from hyperextending your elbow. Okay. Next term you should know for your test is called the abduction adduction. Abduction is away. Okay, AB is away. Add, you adding toward the midline. Okay, you adding toward the midline. So AB away. Okay, you moving away from the midline. Okay, so you could have the adduction and abduction of your feet. Okay, the arm as well, even a hand. You could adduction, abduction, adduction, right? Abduction, adduction. So another term that you should know is elevation and subdepression. You elevating your shoulder, you depressing your shoulder. Elevation, depression, lowering that shoulder bone. Another one to know is called the protraction and retraction. This is only referred to your jaw. Nowhere else in your body you have to worry about. So just know that this one is just for the jaw. So protraction is going forward. Retraction is pulling it back. So you pull it back and you pull it to the front. Sorry. So protraction forward, retraction going back. Okay. From forward going to back. Okay. So that's retraction. A big one to remember is these two, rotation and circumduction. Rotation is you rotating. Let's say if I have my hand here, I'm rotating. Okay, for the hand, it's going to be another name, but for your legs, you rotating your leg. You're twisting your leg in a pivot motion, meaning that it just doesn't go anywhere. Okay, that's rotation movement. Okay, whereas circumduction is basically you making a circle, you drawing an O. Okay, either way. Okay, you making an angular movement of your body. Okay, you tracing that cone of circle or an O or ellipse. Okay, that's called circumduction. You have the lateral and medial rotation. Lateral is basically if you have an arm, you laterally bend out. Okay, your elbow. Okay, um, so you laterally bend your feet. Let's say your feet going laterally. Okay, lateral, medial rotation, lateral rotation, medial rotation. Okay, you could see going out. This is the lateral rotation. Going in like this, your arm is medial rotation. Okay, same thing with here. The hand will move toward this side. This is called the lateral rotation. The hand will move in. That's the medial rotation. Okay, rotating your face, your neck is also rotating as well. There's no medial or lateral. You're just rotating. Okay, rotations. Supination and pronation, also a big term to know. Okay, soup is you asking for a soup. Okay, supination, I'm asking for a soup, bowl of soup, please. Okay, pronating is looking at being prone. We use this term for the body as well. So if I tell you to lie in supine, supine meaning that your face up, that's supine. Prone, mean face down. Okay, prone, face down. Okay, your buttocks on the top. Okay, and then supine, supination, supine, belly up. Okay, face up. And this term right here is only for your foot, only only refer to your foot only. Inversion and eversion. Inversion, you inverting inward. Okay, inverting in, moving your foot inward. That's called inversion. Moving your foot outward is eversion. This is the oftentimes how you sprain your ankles. Okay, how you, people actually sprain their ankle is either you invertedly sprain the ankle or evertedly. The most common one is actually inversion. That's the most common one. That people tend to sprain the ankle with inversion. Rare to see in eversion, but when you see eversion, things tend to become more severe because you actually literally sprain those ligaments. Another one that you should know you're going to see on your test is called opposition. This is where opposing thumb, right? Human could actually have this. Apes and humans have opposable thumb, meaning that oh, your thumb can actually fold and touch your pinky. Okay, your thumb could fall and touch your pinky. That's opposition. Putting it back, it's called reposition. Okay, putting that back is called reposition. Another one to remember is called the dorsiflexion and plantar flexion. Dorsi, okay, going toward your body is dorsiflexion. Plantar is like you stepping on a gas. You planting your foot. You're stepping on that gas. Okay, uh, so dorsi is kind of like lifting your foot up from the gas, ready to brake. Okay, lifting your foot back. That's dorsiflexion. Plantar flexion is stepping on that gas. Another way to think of this is when you walk tiptoe. Tiptoe is your plantar flexion. That's tiptoeing walk. Okay, whereas when you walk with your heel strike, what your heel is dorsiflexion. Okay, that's pretty much it for this chapter. One more thing I want to kind of cover. Uh, has to do with the spine. Okay, and this is gonna you're gonna see this on your exam as well. The picture that you have that I gave you, it's actually based on the spine. If you have something called the so your spine, you have three sections of the spine, right? You have these three sections of your spine. You have the cervical, you have thoracic, and you have the lumbar. Those are three sections. If you actually create a curvature of your thoracic, okay, curvature of your thoracic. Let me show you the picture. If I let's see, let's see. Okay, so let me show you this one instead. Okay, so if you actually have a over hyper creating a curvature of your thoracic spine, if you have the curvature of your thoracic spine, this is called the kyphosis. Okay, this right here is called kyphosis. You actually have a little humpback here. This is called the humpback. When we get older, if you have a bad posture, you actually will end up with kyphosis, which is a humpback. Okay. Um, the one that clearly common for many people having an S-shaped spine. Okay, the S-shaped spine like this is called the scoliosis. Okay, scoliosis is this S shape. So you actually have a lateral, not the forward curvature, but you have a lateral curvature. That's the key term to write down for the scoliosis. Lateral curvature. Okay, of the thoracic and also the lumbar spine. You have it misplaced laterally. Okay, so you're going to have an S-shaped spine. That's called scoliosis. Think of S, think of scoliosis. Okay, so lateral placement, displacement of the thoracic and lumbar. Okay, and we do measure them when we, if you, for those you OT and PT going in, you will know that we actually measure them, and if it's more than a certain degree, you actually need a brace. 30 degree for the spine, you actually need a 20 degree, 10, 20 to 30 degree. We would put people on brace. Okay, different type of back brace, and if more than 30 degree, definitely we could do surgery to correct our spine as well. Okay, the last one is called the lordosis. This has happened with the overcurvature of your lumbar spine. Okay, lumbar spine, when the lumbar actually become hyperextended or having too much curvature uh, on the lower back. This is called lordosis, and this is often happen with women who actually pregnant, especially at the end of the third trimester, because the belly is protruding out in the front. Then the kind of center of gravity really shift out of your spine. Women actually have this pregnancy walk. You've probably seen some of those pregnancy walk, and that's called the lordosis. Okay, you do need to know these three for your test. You're going to see these questions on your exam. Okay. Um, don't worry about the fracture. I won't put those in the exam, but definitely know the scoliosis, kyphosis, and lordosis for your exam. Okay. Well, that's it for this video. Thank you so much for watching, and I'll see you in the next one. Take care.